The World Health Organization recommends that no more than 15% of newborns should be delivered via C-section. In India, the proportion of C-sections is far higher, at 21.5%, and it hides an even more alarming statistic. In private hospitals, it's a whopping 47.4%.
Many doctors wouldn't necessarily explain to a woman what the risks of an unnecessary C-section might be.
Why are C-sections in India's private hospitals so much higher than the country's average and the global norm? Are there just social forces at work, or are unethical decisions being made?
She just came and said, okay, we have to take you for a C-section. And I said, why? What is the reason? What happened? She said, no, it's 3 o'clock, you're still not dilating.
So large number of doctors get paid according to the number of cesarean.
So many millions of women who are really undergoing unnecessary C-sections.
In 2019, content creator and actress Chhavi got pregnant for the second time. It was a long-awaited pregnancy, and she was determined to have a natural birth, just like her first pregnancy.
First time that I was pregnant, I think like most first-time mothers, I didn't know much about what a healthy pregnancy is, but I just knew from my mother that it has to be a vaginal birth. So the second time when I got pregnant, I had read up a lot by then, and this time around I chose a hypnobirth, which basically means that it's going to be an all-natural birth. So no pain management, no medicines, no drips, and you have to push the baby out. That was my plan. I wrote down a birth plan and I circulated it to the head of the hospital, the nursing staff, the entire nursing staff, the pediatrician, and the gynac who was my doctor. So everybody was on board with my plan.
Eustacia Lobo and her husband Ryan became first-time parents after 2 years of marriage. For them, it was a joint decision to go for a natural birth.
I know it's very healthy for the mother and for the baby also. You know, the whole struggle of coming into life is very life-affirming.
I didn't want to be cut. I mean, I said no matter if I have to go through a lot of pain in those couple of hours, then, you know, have your 7 layers of tissue being cut inside.
Cesarean birth, or the C-section in its modern form, began to emerge around 1940. But it wasn't till the 1960s that it became popular. It essentially involves delivering a baby through surgical incisions made in the abdomen and uterus. It is meant to be a life-saving procedure, a medical boon for complicated births.
We need to understand the cesarean section is being done purely and only when a normal delivery is not an option. Cesarean section is needed for sure in situations where there is a risk to the child's life and we need to get the baby out immediately, or there's a risk to the mother's life and we need to get the baby out so that we can handle the mother more appropriately once the baby is out.
Compared to a vaginal birth, a C-section comes with a lot more risks. For one, studies in various countries show that women are up to 5 times more likely to die from delivering via C-section than through vaginal births. Which is why the World Health Organization recommends it only in desperate situations, and it considers the ideal rate to be between 10 to 15% out of all births in a country.
Chances of wound infection, the chances of injuries during the surgical procedure, and all those risks associated with the major surgeries definitely stands.
There are long-term consequences as well.
Now there can be some chronic issues, what we call as there is something called as nerve entrapment syndrome. Sometimes the girl complains of tingling numbness in the lower abdomen, loss of sensation in the lower abdomen. Nerves are actually strained or damaged or pulled apart, and they may cause these phantom symptoms, which may persist for years in a woman's life.
Many women might have a long run back pain, because the abdominal muscles become so loose and flabby. They are not able to support the women.
There is a higher risk of some diseases in the baby as well. So, for example, higher incidence of pulmonary complications or respiratory issues in the newborn have been found in cesarean section when done pre-labor.
Research all around the globe have found babies that come through the normal birth canal carry the microbiomes of the mother, and this actually protects the baby. When a baby is born through C-section, they have found that the microbiomes on the skin of the baby is lost. They develop allergies, they develop asthma when they grow up.
But yet in India, C-sections have become increasingly common, especially in private hospitals, jumping a whopping 400% in the past decade. Today, nearly 48% of births in private hospitals are delivered via C-section. In most countries, it is considered the birthing rights of a woman to choose whether to have a vaginal birth or an elective C-section, unless in an emergency.
కాబట్టి అందరికి కూడా నార్మల్ డెలివరీ ఇంటర్వ్యూ సెక్షన్ ఎప్పుడైనా సరే ఏదైనా ఎమర్జెన్సీ డెలివరీకి అందరిని కూడా మోటివేట్ చేయాలి.
As an obstetrician, Dr. Gauthami Reddy is all for women having a natural vaginal birth. But as the owner of a small private hospital, she sees the logistical strains that can sway hospitals away from performing natural births.
నార్మల్ డెలివరీకి తీసేసుకుంటాం.
The first consideration is time. A C-section is done in under an hour, while a vaginal birth can take anywhere from 8 hours to over 2 days. Slightly complicated vaginal births also require hospitals to be able to switch to a C-section quickly should an emergency occur.
సో ఇవన్నీ ఖచ్చితంగా నేర్చుకోవాలి ఎప్పుడైనా. ఈవెన్ దో వీఆర్ డూయింగ్ నార్మల్ డెలివరీస్, దట్ C-section kit and C-section like anesthetist and OT assistants, everybody should be available. We are very happy. We are bringing down the C-section rate, but it's showing a lot of impact on doctors and medical staff also.
And should the vaginal birth be successful, hospitals find themselves absorbing the costs of the resources put on standby, as these are usually not billed to the parents. This can be hard for smaller maternity outfits, where such resources are shared by fewer patients. As a result, a scheduled elective C-section becomes the most cost-effective way to deliver a baby. But does this mean some mothers in India are being forced into unnecessary C-sections in the name of profits?
If they are said, your baby might be in danger. So 99% parents will say, whatever it is, do a cesarean but save the baby. Now whether that baby is actually in danger, whether actually there is fetal distress, this is often a grey area.
When Chhavi Mittal received news that she was pregnant with her second child, her usual gynecologist wasn't available. So she took pains to spell it out to a new doctor how she wants her second delivery to be managed.
I told her, you don't have to guarantee me anything, but as long as there's no emergency or there's no complication, are you on board with my plan? I will meditate during my contractions and I will do the pain management through that, but I don't want epidural, I don't want any kind of medical interference in my delivery. And she said okay.
Things were going well at first. But one day prior to her expected due date, Chhavi's doctor suddenly suggested inducing labor.
And I told her that no, I want an absolutely natural birth. When the baby is ready to come out, I will go into labor.
Induction is done only when is required, when there is maternal or fetal distress. If there's a medical emergency, then we do. Okay, that is one of the conditions. So one can wait till 42 weeks. Usually by 40 or close to 41 weeks, most of the mothers deliver on their own, or the labor starts on their own.
Being in her 39th week of pregnancy, and with neither mother nor baby in distress, Chhavi stood her ground and refused induction. And it was an informed decision. More than 90% of babies are born 2 weeks on either side of the predicted date. And that is the case for Chhavi. On her 41st week came the first signs that her body is ready to give birth.
So everything was perfect the night before. I still remember it was Mother's Day, and my membranes released, my water broke. We went to the hospital at around 12 in the night. Was checked and everything was fine, and mild labor also started. By the next morning at around 7 o'clock, I was already 7 centimeters dilated. By the time the doctor came, she was very happy to see the dilation, and she said, okay, very good, we should have a baby in our hands at around 9 o'clock.
But just 2 hours later, without her explicit consent, nor the consent of her husband Mohit, the doctor administered an injection.
When this injection was administered, I suddenly got a panic attack. My throat became absolutely dry. My heart started racing and I started shaking. It happened instantly. Like, she was still administering the drug when I started feeling like that. I said, what did you just give me? Why did you do that? What's happening to me? She said, nothing, relax. This is just to hasten the labor. And I thought, why do I need to hasten the labor? They were monitoring the heartbeat and there was no distress and everything was absolutely fine. After that, it was just all downhill. I could not get back into the zone again because suddenly my mind was alert and I could feel all the pain that was going on. The labor pain, I actually started feeling it and my mind just couldn't focus on anything else. And my dilation suddenly stopped. I just stopped dilating after that. For the next 2-3 hours.
She was given Pitocin, a drug to induce contractions. It can help to accelerate dilation, but only if the cervix is at a certain stage of readiness. What's more, Pitocin can make labor far more painful and intense.
And if all things are okay, then one does not need unnecessary medical interventions like induction or starting a drip. I mean, one tries to hasten the process, but it can lead to distress in the baby. When we do an induction, we have to inform the parents the pros and cons of the induction, that it might fail, the chances are high you might go for a C-section.
Nothing which was explained to me. It was just sounding like a rant from an irritated person that, oh God, I've been sitting from 9 o'clock. I thought the baby is going to come out at 9 and it's 3 o'clock in the afternoon. You're ruining my Sunday. Okay, we have to take you for a C-section. And I distinctly remember saying yes, okay, we'll go for a C-section. And Mohit asked me, why? Why did you say yes? I said, I don't know, baby. I don't know, but do you think we should doubt the doctor? What can we do? There's nothing we can do. You know, Mohit spoke to me and said, are you sure you want to do this? Like, you know, you've already come so far. You've completely taken all the pain. You're 8 centimeters dilated, another 2 centimeters to go. Do you really want to do this? And I said, I don't know. I cannot think at this point. If the doctor is saying, then I'll do it. And then we came out and I sat on the wheelchair and I was wheeled in to the OT.
When the Singhs found out in December 2020 that they were expecting their first child, they were elated. Abhilash Singh is a young, successful businessman, and he wanted the best for his 25-year-old wife, Sakshi. They opted for a private maternity hospital with about 50 beds, which boasts state-of-the-art facilities.
पता चला कि ये के हॉस्पिटल यहाँ पे जो है मतलब गायनो हैं और इनके हस्बैंड जो है ये बच्चों के डॉक्टर हैं, तो ये हुआ कि ठीक रहेगा भाई, दोनों डॉक्टर पास में हैं और यहीं पे ट्रीटमेंट कराते हैं। लेके गए, दिखाए, सब नॉर्मल था। फिर टाइमली जो भी चेकअप इन्होंने बोला हमने कराया।
The gynecologist assured them that the pregnancy was going well. Yet, in Sakshi's 37th week of pregnancy, the doctor recommended a C-section.
डॉक्टर ने माहौल बनाया तो पापा का मेरे यही कहना था कि ये बताइए मेरी बिटिया को कोई दिक्कत तो नहीं है, मेरी बिटिया में साक्षी को 100% नहीं, अगर प्रॉब्लम हो सकती है तो वो बेबी को हो सकती है।
Fearing the worst for the baby, the family decided to go with the doctor's opinion on the need for a C-section.
इन्होंने ऑपरेट किया, हुआ, इनके कहने के अनुसार बच्चा बहुत कमज़ोर था, इन्होंने NICU में तुरंत बच्चे को ले गए।
Within a day, his wife had an adverse reaction to the C-section.
बीपी फ्लक्चुएट करने लगी, 190 चली गई और फेस पूरे रेड से ब्लैक होने लगे, हाथ पाँव मारा, चिल्लाया तो डॉक्टर आए, कोई इंजेक्शन लगाए, सब नॉर्मल हो गया। हम लोग बोले क्या मामला है, तो बोले कि ये नॉर्मली होता रहता है ऐसे केसेस में, आप टेंशन मत लीजिए, हुआ ठीक हुआ, डॉक्टर साहब को आने दीजिए। तो डॉक्टर साहब रिएक्शन के बाद 28-30 घंटे नहीं आई, दोपहर में 2 बजे आके कह रही है फ्रूटी पिलाओ, हो जाएगा।
When the doctor eventually came round, she initially dismissed Sakshi's condition.
क्योंकि जब इन्फेक्शन हुआ उसके बाद यूरिन भी पास नहीं हुआ और पेट जो है फूलने लगा।
Finally alarmed at the situation, the gynecologist asked the family to take Sakshi to another hospital.
और इनके रिफर करने के बावजूद वहाँ एडमिट नहीं ले रहे थे, तो वो तो हमारे परिजन, हमारे घर वाले सभी लोग हाथ पैर जोड़े डॉक्टर का, तो उन्होंने एडमिट किया।
But it was too late. Septicemia had set in.
उन्होंने बता दिया था कि 95% ऑर्गन्स फेल्योर हो चुके हैं। फिर उन्होंने अपना पूरा प्रयास किया, नहीं रही।
That was just the start of the nightmare. Abhilash and Sakshi's baby had been delivered surgically in the 37th week of pregnancy. A highly risky move, as babies born that early are often underdeveloped and need intensive care.
Betu, Betu mera, Betu.
लास्ट मंथ में ऑर्गन्स डेवलप करते हैं।
Betu, Betu, Betu.
तो इन्होंने प्री मेच्योर डिलीवरी करा दिया था, तो बाबू का जो लीवर और हार्ट का कोई स्किन है जो चिपका हुआ था, तो और प्री मेच्योर डिलीवरी की वजह से बेटा भी मेरा जो है 29 तारीख को जो है कि 29 नवंबर को एक्सपायर कर गया, वो भी नहीं रहा।
What is the pretext for doing a cesarean? Usually, the commonest reason that is given is fetal distress or the baby is in danger. Now imagine a mother who is in labor and the family, the parents, if they are said, your baby might be in danger. So 99% parents will say, whatever it is, do a cesarean but save the baby, Now, whether that baby is actually in danger, whether actually there is fetal distress, this is often a gray area.
Abhay Shukla is the co-author of Dissenting Diagnosis, a book exposing the ways in which patients are being exploited by private hospitals in India.
The primary factors are that One average cesarean section, if the hospital is charging 70,000, 80,000. Another factor is the doctor's time. You see, in normal labor, especially in the first delivery, there actually the labor process itself may take 10 hours or 12 hours. And the doctor and the nurses and the team have to continuously monitor the patient for 10, 12 hours. In cesarean, everything is over in half an hour or 45 minutes. So the doctor's time also, they feel that this is probably more sort of, convenient. The cesarean appears like an instant solution. In public hospitals, the cesarean section rate is 14%. In private hospitals, it's 48%. So it's almost 3 times. So that means that obviously the main driver of higher cesarean section rates is commercial profit being made by private hospitals.
You are muted, Amita, unmute.
Dr. Madhavi is a counselor who helps women with their pregnancy journey. In her experience, one of the most common reasons that a doctor gives for an emergency C-section is the umbilical cord around the baby's neck.
During labor, if there is cord around the neck, the doctors very easily tell that it can strangulate the baby, but that is not true. As the baby moves down, the birth canal and the placenta also moves down. For the baby, it is a very natural process, but for the mother, they start visualizing baby getting strangulated because of the cord. Okay, so that is the fear or the panic factor that sets in here.
We have mentioned this in our book also, that for example, we have seen these kind of cases where the patient was sent for a sonology and then she was told that the cervix is too small and she will require a cesarean. And then when she took a second opinion, it was found that actually the sonography report was normal and she did not require a cesarean. So there is a need for a protocol. Today we do not have standard protocols for when to do a cesarean and when not to do a cesarean. These have been done in other countries.
She did the ultrasound and she said that the water is less. And she said, I'll induce you. I went to another place and I asked the doctor over there and I asked him, is my water less? He said, no, everything is normal.
Serious illness is a relatively rare event, but childbirth is a normal event. Almost every woman will undergo one or more childbirths, so it's much more common. So medicalization of childbirth is commercially quite lucrative, and that is where the rise in cesarean sections comes in.
When Abhay Shukla began researching his book on unethical medical practices, he discovered that private hospitals are opting for unnecessary C-section births, all for financial gain.
We interviewed 78 whistleblower doctors, mostly working in the private healthcare sector, and they talked about the reality of commercialized private healthcare in our country today. So large number of doctors, especially senior doctors who are working in corporate hospital, they work as consultants. So which means that they get paid according to the number of procedures that they perform. So if they don't do a cesarean, they will get a small amount. If they are doing the cesarean, then they will get a much larger amount.
The math works out for private hospitals. A natural delivery usually entails just an overnight stay. But a C-section often means up to 4 days of hospitalization, plus expenses for the operating theatre, with a total bill that could cost nearly 8 times as much.
Today in our country, nearly half of the deliveries in private hospitals are being done through C-sections, which is very high because the WHO has recommended about 10 to 15% from a medical point of view. So roughly 2 out of every 3 deliveries in private hospitals today, the cesarean sections are unnecessary. This is a huge waste of resources, and it's also not good for the body of the mother. From both points of view, from the financial and the medical point of view, these are unjustified.
We're more ready for a C-section than a vaginal birth. Conducting a vaginal delivery skillfully is serious work. It's much more time consuming. It takes much more skill and training in one level, on the part of the doctors, the nurses, the entire labor delivery staff, So C-section is something, it's so common now in the country, it's very easy to do a C-section and not look back. Like anything that you do, it's only when you do it that you retain the skill of doing it. So as the rate of vaginal delivery decreases, that means we have fewer and fewer doctors who are actually experienced in conducting a vaginal delivery.
For most of Eustacia's gestation period, her weekly checkups indicated she was on track to give birth naturally. That is, until a day before her estimated due date, 25th of July.
On the 24th, she said, you go and do an ultrasound again. And then she said, your water looks less. And she said, I'll induce you.
But, according to Eustacia's written medical records that day, her liquor, short for the Latin phrase liquor amni, or amniotic fluid, was adequate clinically. But Eustacia wasn't aware of this on that day. Her doctor's warning that her water was low and that she should be induced sent her into a panic.
And I went up to Ryan and I said, Ryan, she wants to induce me. And you said no. Why do you want to induce her? Let it come naturally. Why do you want to do something like this? His was a firm no, to which she called me inside her office and she said, see, husbands don't know what women go through. So I trusted her. I went to her. I said, I put my trust in, and she kind of said, don't listen to your husband. He doesn't know your body. You know your body and I know your body because I'm a doctor.
So by that time, I called my mother, we called her mother, and we asked them, what is this inducing thing? And they said it's a tablet to chemically induce pregnancy or
forced labor.
Forced labor, right? So I said, that's not natural, right? Why do you need that? You feel like a lot of pressure on you. You feel like if you don't make the right decision, then things are not going to go well. It's like that. One of the most regretful things that I said, let's trust the doctor.
I went back to her office and she said, okay, I'm going to give you a pill and it's going to increase the labors. And then eventually your cervix will dilate and you'll be able to give birth. So we said, how many tablets I got to take? She said, up to 3 tablets. So she gave me the tablet about 10 o'clock in the mornings, and by 2 o'clock, she induced me with the second tablet. And the labors started to get intense. It was really painful.
These forced labor contractions are even worse than the natural contractions. Because they're chemically induced, they cause a lot more pain.
I don't feel anything happening. All I can feel is pain and pain and pain. At one point, even touching me was like such a excruciating pain. So she comes, I think, at around 8 o'clock, right? And she says, cesarean. And that was the shock of my life. She said, cesarean. I was like, all these 9 months, I was dreaming of a natural birth, and now it's cesarean.
Induction of labor is usually medically necessary when there is a problem with the mother's health or the status of the cervix. In Eustacia's case, neither seemed to be the problem. The couple thinks that Eustacia has been induced to go into labor far too early, and that resulted in an unnecessary C-section becoming necessary.
So what happens is, when the baby is ready to come out of the body, the baby should be placed head down. However, in our case, I think Eden was still sideways. Basically, the baby was not ready to be delivered. So she gave her the tablet despite knowing the fact that the baby is not ready to be delivered. So obviously we're going to get into all these complications.
The thing is, when you are induced, you just can't go back now. There's nothing.
There's no going back.
You have to do a C-section because your life and your child's life is in danger right now.
In India, we tend to not wait expected due date. And if a woman has not spontaneously gone into labor by then, she'll be induced. And when you're induced, you're much more likely to then undergo a C-section.
So in 10-15 minutes, they said, congratulations, it's a baby girl. I didn't even see the face because I just saw her back and they took her out. But I was like, why are you taking her out? And they're like, no, the baby can't be in the operating theater, okay. And then I blanked out. They injected me with something to put me to sleep.
A natural birth, there is pain, okay, but it's short-term pain, and then it's very healthy, very easy to recover from that. You can walk up the next day, you can do whatever you want, you know. But with a C-section, for the next, 20-30 days, you are very sore.
Yeah.
And I think for, 6 days after that, you can't get off the bed or something. There's a lot more complications, a lot more pain involved in a C-section than there is a natural birth.
You can't sit up, you're like a vegetable flat on the bed.
Yeah.
You can't turn, you're 5 inches, 4-5 inches cut down there, 7 layers so deep. It's very painful. I'm on this bed, I can't hold my baby, you can't turn. And feeding was such a painful thing because you want to breastfeed your child, you can't get up. For the first 24, 48 hours, you just can't do it. Someone has to come bring the baby near you. You can't change the nappies. When your child cries, you have to search for help. It was very difficult.
After the traumatic birthing experience of their first child, Ryan decided to make a short documentary film called The Unnecessarian.
It was our burning desire to have a natural birth, but it was stolen from us. I said, this is an important topic. Why don't I make this film about her experience? That feeling of victimization, you know, you are a victim of this person's unethical actions. And I thought to myself, it would be very helpful to Eustacia if she confronted the doctor.
Like, I spoke to the HOD of GMC Gynac, and he gave me a list of reasons why cesareans are, required. But none of these cases are present in our case.
The reason your position was not correct. Because you're not ready to be born that day.
Yeah.
Her head is not ready. I should have waited for another 4-5 days, so her head would have probably come in the right position.
We have to tell you the fact, right? If something happens later, it's not in my hand.
I didn't want to induce myself, and you said to induce.
But normally I wait till 40 weeks, 4 days, 5 days.
No, I was induced 40 weeks exactly. So honestly, I felt betrayed.
After her first botched birthing experience, Eustacia held out hope that she would be able to experience giving birth the natural way for her second child. But she was thrown a curveball. By the Christmas of 2019, the Lobos were expecting again. Eustacia was 7 months pregnant with their second child. But it was bittersweet. This time, Eustacia knew it would be risky for her to have a natural birth, given her first unnecessary C-section.
The doctor said, if you want to have a natural birth again, wait for 2 years. Let the womb completely heal, let the scar tissue heal properly, and then when it's strong enough, then you can conceive again. Eden was about 10 months. I was like, oh gosh, I'm pregnant again, and I was upset with it. I was disappointed because all these thoughts came back to me. You know how you went through with the first delivery, and your womb is not healed completely, and there's 90% of you having a cesarean now.
A majority of mothers who have a C-section the first time end up with a repeat C-section.
Second time around, when the woman gets pregnant, The risk she faces if she sets into labor and attempts a normal birth is a 0.5% risk of the uterus rupturing, the previous scar giving way, but the risk is small. The point is how many of us are willing to take that risk. If she gets pregnant the third time, the risk of her having what we call an adherent placenta is very high. The blood vessels penetrate the whole wall of the womb, and she could bleed. That could be life-threatening.
Subarna Ghosh is a crusader for women's birthing rights. She focuses on unnecessary cesareans after suffering one herself.
I was 25, so I was really quite young, and I had no physical complications. The doctor said, okay, so you can pick the day, and I was listening to this and very confused, because how would he know the exact time of labor? And then he reassured me that don't worry, you will not have to undergo labor really, because these are very primitive ways, waiting for labor, undergoing labor. I mean, the whole scientific temperament that he was showcasing was all about, how everything has become so much modernized and women do not have to go through the kind of labor that my mother or my grandmother has gone through, and that the system has completely changed, and now it's just a matter of a 4-inch cut.
Subarna felt exploited by a doctor. She decided to do something about it.
We were somehow, as women, we were totally unaware of what were our rights and what are the things that we can ask for and what kind of information should we have access to. And I came across papers where very simple ways of reducing cesarean section. I went through some of the guidelines that World Health Organization had given, and I picked up the simplest of things. That little key was just a simple, transparent audit of hospitals.
There is no national audit of C-sections done by hospitals in India. The government puts the onus on hospitals to do a self-audit.
It's not like hospitals don't have an audit. There is an audit. But I said, what happens to those audits? As a consumer, as a woman who is going to that facility, what do I find out about that facility? So the World Health Organization says that if data that is audited for is made public, that itself can be a complete game changer. A woman can clearly understand that if there are 2 facilities in my neighborhood and I am a low-risk pregnancy, I will look at those data and say that, this has better cesarean section rates, it's lower. And I don't have a high-risk pregnancy, I might as well go there. Perhaps the approach of the doctors are different. Perhaps the kind of care they're giving is different.
Are you doing your exercises, yoga, anything?
From few days, I'm not able to do.
If you've already had a first normal delivery, your chances of having a normal delivery are very, very good. Vaginal delivery, although it is perceived as a painful thing, but the pain is a process of uterine contraction and expulsion.
Right.
Whereas a C-section, there will be still post-operative pain, even if you think that there will be anesthesia given to you at the time of procedure.
But in 2017, Subarna found that few Indian hospitals display their C-section rates. So, she started an online petition to urge the government to force hospitals to do so. Over 390,000 people have signed the petition to date. In India's decentralized healthcare system, it is the state government rather than the central government that regulates private hospitals. But shortly after the petition, the Indian central government did make one significant announcement. It mandated that all private hospitals serving employees and pensioners of the central government would have to make their C-section rates public. That's 2,000 private hospitals across the country. But it's a drop in the ocean, given that there are about 43,000 private hospitals in India. It was up to the state governments to truly rein in those hospitals. R.V. Kannan is the district administrator of Karimnagar town in Telangana state. His town had the dubious distinction of the highest rates of C-sections in the country.
We heard about around more than 95 to 96% deliveries happened in the private sector were C-section deliveries. So that was a high alarming rate. So we thought to first initiate the talk with the major stakeholder. Series of meetings we conducted with them. So pregnant women keep on changing, but the gynecology will be a constant one. So we told them very clearly that we are against the avoidable C-section.
With nearly 400 private hospitals and 70 gynecologists, mothers throng to the medical hub of Karimnagar for treatment, especially for deliveries. To track those numbers, the district has mandated that all hospitals have to update their delivery details in an online portal, which is then combed through by a team to spot forcibly performed or unnecessary C-sections.
So already we are doing this job. We have to be more strenuous and primary entamandi normal ayindi. We have to cross check. For example, first name is that hospital. They have done 69% of the C-section last time. Out of that, how many are primaries? If mothers or the family doesn't want a C-section, if they want to go for a normal, with all the regular healthy things going on in progress and forcible C-section is going on, if they give a complaint or if we come to know, immediately we can close that hospital.
Most ordinary patients will not know as much as the doctor and the hospital staff which is treating them. This knowledge asymmetry needs to be overcome consciously. People need to be given basic awareness, and understanding. So, for example, the way in which government often publicizes the need to undergo vaccination, or for women to, undergo antenatal care, or to, feed your children better. Similarly, there should be messages about avoiding irrational care. Don't go for unnecessary cesareans.
Chhavi Mittal, who was manipulated into having a C-section, considered legal action against her doctor.
I consulted a lawyer, and basically what happens is that in the file, the language that was written was also quite alarming for me. For example, if a nurse walks in for a medicine and I'm feeding the baby, so if I tell her that please come later, she would go and write in the file, medicine refused by patient. Just that. So it's very difficult to prove anything. The doctor can prove whatever she wants because she's the medical expert. The doctor can always come and say that no, there was an emergency, she just didn't know it. I told her, how do I prove that she told me? How do I prove that she didn't tell me anything or she didn't say anything like that? So there were a lot of loopholes, and it's very difficult to fight a case like that. I realized that it's no light at the end of the tunnel. I went into depression for a few months. I think the breastfeeding was a struggle, probably also because of my mental health at that point. Even after 7-8 months of the surgery, my stitches were not 100% fine. They would still pain every now and then, and there's still no sensation in that area.
As an outlet for her anguish, Chhavi has taken to social media to share her story.
I felt that if this has happened with me, probably it's happening with a lot of other mothers as well. And if I can share my story, maybe other mothers can also come out with theirs and share their experiences.
But that would not be possible for Abhilash Singh's wife, Sakshi. Abhilash lost his wife, Sakshi, because her C-section site got infected. His son, who was prematurely delivered, died soon after. Abhilash believes their doctors, a husband and wife pair, are responsible for their deaths. But despite making an official complaint to the Medical Board of India 3 months ago, he still awaits justice.
मैंने बहुत मीडिया में और बहुत सारी हमारे गांव की घर की फीमेल लोग भी जाके हमारे साथ वहाँ धरना दी, वहाँ हंगामा किए। मीडिया में हर रोज मीडिया में आता रहा इनकी खबर।
हमें अगर न्याय नहीं मिलेगा, हम यहीं पे अमलान संग बैठेंगे बिना खाए पिए, यहीं पे जान देंगे, यहीं पे हम।
जागेगी भाई जागेगी, नारी शक्ति जागेगी, जागेगी भाई जागेगी।
मैंने इसलिए किया क्योंकि कम से कम चीज़ों से अवेयर हो लो। जब मैंने हंगामा किया, मैं फ्रंट पे आया, मैंने बहुत कुछ फेसबुक वगैरह पे किया, बहुत सारे शेयर, लाइक्स, व्यूज़ हुए, फेसबुक पे, हमारे सोशल मीडिया पे भी, तो मुझे बहुत सारे फ़ोन आए, भैया ये तो हाँ वो तो मुझे भी, मेरे भी वाइफ के साथ ऐसा किया, मेरी दीदी के साथ ऐसा किया, हमने भी इतना कुछ किया तो इसीलिए किया था, कोई और साक्षी के साथ ऐसा ना हो।